We were in firefights, and I did not know if I would be around the next day or not. And like a lot of people, I said to God, if you get me through this, someday, somehow, I'm going to do something really nice for the world. I had no idea at the time what that meant.
Impactful.
Trailblazing.
Visionary.
Sincere.
Relentless.
Wise.
Exemplary.
Intolerant of the status quo.
And I can't leave out smart.
Selfless.
Thankful.
Passionate.
Loving.
Caring.
Extraordinary.
And brave.
In the beginning, the primary mission was to create an organization which would somehow lower the cost of health care.
I've always loved seniors, and I've loved spending time with them and hearing their stories. And so I told Gary if we ever have an opportunity to help, I wanted to do that.
Every penny of money that we have ever made and ever will make is going to go to our philanthropic endeavors. And it was just a promise I made to God, and I'm a man that tries to keep my promises, so I'm going to do that.
For those of us who have had the pleasure of working with Gary and Mary, one thing is clear. Their unwavering determination is matched only by their heart. It is the combination of head and heart that has led us down a seemingly impossible path of courage and fortitude to tackle the biggest issues facing Americans today: the financial, health, and social insecurity of seniors. And for all of us, the outrageous and skyrocketing costs of healthcare. 10 years ago, their conviction led to the creation of a one-of-a-kind organization, the West Health Institute.
Today, it is our privilege to announce our commitment of $45 million from our foundation to create the Gary and Mary West Wireless Health Institute.
From the beginning, Gary and Mary's entrepreneurial spirit and patriotism has driven West Health and its mission.
Within the first year that we were here, we had put together a world-class team, and that was because of Gary and Mary's commitment to the mission.
Now is the time to unleash the spirit of American innovation to help reduce the cost of healthcare. If there was ever a time, this is it.
So we were literally looking at everything from how do we develop proprietary technology and create days in Washington, how do we create policy, and a whole lot of other things.
We specifically built Reflection in value-based healthcare, targeted toward lowering the cost of healthcare while improving access.
I think the due diligence that this institute did to allow it to be launched was probably one of the most extraordinary things, and that's really paid off. So
I think we quickly learned that the problems aren't going to be uniquely solved by any one particular technology, but there needs to be a mindset, a realignment of incentives, and a different focus.
The last decade has been an incredible journey and an important lesson in what it means to conduct meaningful, applied medical research. Research that is translational, that is impactful from the start. Research that will change how, when, and where care is delivered. Research that will ultimately validate lower-cost models of care.
As we evolved our thinking, what I'm most excited about is where we sit today. With Shelley's leadership and Tim's leadership, we are some of the most recognized and credible voices in the country to demonstrate models of care for seniors that are going to make a difference.
We are proud to be one of the only medical research organizations in the world focused on aging. Our unique approach is driving powerful and sustainable change. In fact, 2019 was a year of incredible accomplishments. Releasing Gallup surveys that prove Americans are getting crushed by the high cost of healthcare. We're bringing together leaders to shine a spotlight on common sense policy solutions. And we're innovating models of care, like the opening of the Gary and Mary West PACE program, the expansion of our senior dental centers, the launch of a statewide GED network, and a collaboration with Dartmouth Hitchcock to provide emergency care for rural seniors in the 3 grayest states in the Union. And of course, our very own Senior Emergency Care Unit at UC San Diego Health. The combination of our teams at the West Health Institute, the Gary and Mary West Foundation, and the Policy Center are going to continue to evolve and remold healthcare for generations to come.
They've created an environment for people to do important, mission-driven, purposeful work.
By virtue of their efforts and their success, they have an opportunity to multiply that. But they want to do that at scale. And they don't want to waste time, and they don't want to waste resources, but they want it to work.
It is what they have become singularly focused on. And we're going to make a stand, and we're going to make a statement, and we're going to make this happen. Their legacy will be a better system. It'll be people who live a better quality of life.
It is about results-based philanthropy. You have 2 of the most passionate, committed people in the world in Gary and Mary that are going to invest the time, talent, and treasure. These people are serious about changing how people age in America when it comes to healthcare.
We have to figure out ways to allow our healthcare system to serve more people more cost effectively than it's doing now. And I think that we're a better, more focused organization today as a result of our thinking on those things.
Thank you, Gary and Mary, for the opportunity to join you in a cause worth fighting for, a cause worth sacrificing for, a cause that will improve the lives of all American seniors and their families.
Gary and Mary, thank you. You've given us so many resources. You've given us such great guidance. We're doing great things. We're going to continue to do great things. And it's because of your vision, your dedication, and your passion.
Thank you, Gary and Mary West, for your personal, direct involvement in the work of this organization.
You are unbelievable people. Your dedication is just something I've never seen, and I'm so thrilled to be your partner.
Gary and Mary, thank you for making it possible, not just for my aunt to receive better care one day in Milwaukee, Wisconsin, but for all the aunts and moms and uncles and dads out there to get the care they deserve when they go to emergency departments across our country.
The greatest thanks I could ever give you is to just work every day along the same mission, along the same vision, and just creating the good that you're trying to create as well.
You are 2 of the most special people I've ever met in my life. Your generosity, your vision, your compassion for people is a role model for me.
Thank you for the things that you've done for other people that really show the way that you can be a difference in this world.
Thank you for what has really become a powerful force for good in this country.
So Gary and Mary, I want to thank you from the bottom of my heart. You've impacted so many lives, people that I will have never met, people that you may have never met.
Your amazing hearts, the amazing passion that you pour into the work that we're doing here at West Health.
You're making an impact on millions of Americans, and I don't just mean seniors, because we know what's good for seniors is good for all.
Thank you.
Thank you.
Thank you so much, Gary and Mary.
Thank you.
Thank you, Gary and Mary.
It is through your generosity, through your kindness, and through your vision and leadership that we all get inspired every single day.
And I hope it's rewarding for Gary and Mary to see where we are today and what we are setting up to do in the next few years.
Gary and Mary, thank you. There is no greater thank you that we can give than the service of our hearts and minds. And this is only the beginning.
For a senior, when you're a little older, it sometimes is difficult to manage and to get through all the curves that you're presented with. And all I can say is thank you, and just thank you.